We're going to use this x-ray as an example to talk about what our options are when we've got a degeneration of the compartment in one part of the knee. And again, as a reminder, a degenerative knee is one that's had some wear and tear to it, but so that means that some of the cartilage on the end of the bone is wearing a little thinner, and very likely a little bit of the meniscus, the shock absorber pad, has having some small fraying or tearing in it, but it's not to the point of bone-on-bone arthritis. What I'm an expert in with what are called robotic assisted knee replacements, those really do well when bone is touching bone, when you have that bone on bone arthritis. But when we're short of that, we have other options. And honestly, the non-operative ones are usually the ones that work the best. Those can be things like taking anti-inflammatories. Over-the-counter Aleve or ibuprofen are some common ones. And there are some types of injections that people will try, and occasionally wearing a neoprene knee sleeve. These are like the scuba diver wetsuit materials that you can get at like a sporting goods store like Dick's or Dunham's. Those help if you're having an increase in symptoms, and you wear them as needed, and then when the knee gets feeling better, you don't have to wear them. Those sorts of things really do well for kind of managing the symptoms and maximizing the life expectancy of the cartilage we do have left in the knee. In fact, there are special doctors that specialize just in this type of sports medicine, and we can recommend some of those in the area that help with this sort of non-operative intervention. And then if it ever gets to the day where the bone is touching bone, it's a pretty obvious transition. People usually can tell, and then certainly down the road we'll discuss knee replacement options if that makes sense in your situation. Occasionally someone will ask me, well, what about a scope, an arthroscopy, where they go in a sort of cleanup procedure? And that does have its place on occasion, but it really should only be used for if the knee is locking up and refusing to move. That is a very rare thing. It actually doesn't happen very often. In those cases, a scope can be helpful. In cases where that's not happening and it's just pain in a degenerative knee like this, a scope actually accelerates the arthritis progression and can make you lead to a knee replacement faster, and so we don't routinely recommend that. If you have any questions, any problems about this, or anything that has to do with a degenerative compartment, please feel free to reach out to myself or my staff. We'll be happy to help. Have a great day.